The United States faces a crisis in maternal health, a crisis that disproportionately affects Black women. Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. This disparity is a resounding indictment of a healthcare system that fails Black women. It is fueled by historical and contemporary racism. Despite advances, the gap in maternal mortality rates remains. We must confront this crisis head-on. The lives of Black mothers and their babies depend on it. At the heart of this crisis lies a toxic combination of implicit bias, delayed treatment, and systemic neglect. Implicit bias, often operating at an unconscious level, can lead healthcare providers to make assumptions about Black women's pain tolerance, healthcare literacy, and even their willingness to adhere to treatment plans. These assumptions, often rooted in harmful stereotypes, can have devastating consequences. Delayed treatment, another insidious manifestation of this systemic failure, further exacerbates the risks faced by Black mothers. Studies have shown that Black women are less likely to receive timely and appropriate care for pregnancy-related complications, leading to delayed diagnoses, inadequate treatment, and ultimately, poorer health outcomes. This delay in care stems from a complex web of factors, including implicit bias, communication breakdowns, and a lack of cultural sensitivity within the healthcare system. Systemic neglect, the most pervasive and insidious of these factors, acts as the bedrock upon which this crisis is built. Black women often face a healthcare system that undervalues their lives and experiences, dismissing their concerns, and failing to provide culturally competent care. This neglect manifests in various ways, from inadequate access to quality prenatal care to a lack of diversity among healthcare providers. The convergence of these factors creates a perfect storm, leaving Black mothers vulnerable and underserved. It is a system that routinely fails to recognize their humanity, their pain, and their right to quality healthcare. This systemic failure demands our attention, our outrage, and our unwavering commitment to dismantling the structures that perpetuate it. One of the most insidious aspects of this crisis is the fear that many Black women harbor about expressing their concerns to healthcare providers. This fear, rooted in lived experiences of dismissal and disbelief, can have life-altering consequences. When Black women feel unheard, their concerns minimized or ignored, they are less likely to seek timely medical attention, leading to delayed diagnoses and potentially fatal complications. This fear is not unfounded. It is born from years of systemic racism and bias within the healthcare system. Black women have historically been subjected to medical experimentation, their bodies violated and their voices silenced. This painful legacy continues to cast a long shadow, fostering an environment of mistrust and apprehension. The consequences of this silence are profound. When Black women are afraid to speak up, their health suffers. They are less likely to advocate for themselves, to question medical decisions, or to seek second opinions when needed. This silence becomes a dangerous barrier to receiving quality care, further perpetuating the cycle of health disparities. We must create a healthcare system where Black women feel safe, respected, and empowered to advocate for their health. This requires a fundamental shift in the culture of medicine, one that prioritizes listening to Black women, believing their experiences, and valuing their expertise in their own bodies. The crisis of Black maternal health is linked to high rates of preterm birth and low birth weight among Black infants. Black babies are more than twice as likely as white babies to be born prematurely, facing lifelong health risks. This disparity results from social, economic, and environmental stressors impacting Black women. Chronic stress from racism leads to physiological changes affecting pregnancy outcomes. Racism and implicit bias in healthcare contribute to inadequate prenatal care for Black women. Addressing these issues requires expanding access to quality prenatal care and creating supportive communities. The crisis of Black maternal health is further compounded by the deeply troubling issue of medical interventions performed without informed consent, Black women are more likely to experience disrespectful and coercive care during labor and delivery, often feeling pressured into medical interventions they do not fully understand or consent to. This violation of bodily autonomy is a direct result of the systemic racism and bias that permeates the healthcare system. The historical context of medical experimentation on Black bodies casts a long shadow on this issue, fueling mistrust and apprehension within the Black community. The legacy of forced sterilizations, unethical research practices, and medical exploitation has created a deep-seated fear of medical institutions and a reluctance to trust healthcare providers. This mistrust is further compounded by contemporary experiences of bias and discrimination within the healthcare system. The lack of culturally competent care exacerbates this issue. Black women often encounter healthcare providers who are not culturally sensitive or responsive to their needs and concerns. This lack of cultural understanding can lead to miscommunications, misinterpretations, and ultimately, a breakdown in trust between patient and provider. Ensuring informed consent for all medical interventions is paramount to addressing this crisis. This requires a fundamental shift in the culture of medicine, one that prioritizes patient autonomy, respects cultural differences, and dismantles the power imbalances that perpetuate these injustices. Black women have the right to make informed decisions about their bodies and their health care, free from coercion, manipulation, or disrespect.